Oh, my main motivation were the patients. When I was in med school and then residency, we have to go through rotations. So I did quite a few rotations in oncology. So their story, their journey, I mean, that was the main motivation. So it's very different because you're there for the patients from the beginning till the end. So you're part of their journey. You're part of their whole difficult ordeal and trek. So whereas in other specialties, you're there for a specific point in time and then you're gone. It's absolutely, the best time to be an oncologist. The science is evolving, by the day, and we're seeing more and more new developments, new approvals, new drugs, targeted treatments, immunotherapies, in all different fields and all aspects of oncology. So it's a fascinating time. There are so many cutting-edge treatments that we are able to offer to the patients, whereas in many other community centers, they're not able to get the same options. So we're part of in this national and international network where we're able to offer so many different trials with cutting-edge technologies and newer drugs and newer and up-and-coming, treatments to the patients. Because, sometimes we have more options than many of the academic centers. I mean, we have a phase 1, drug development unit here in Fort Myers and then one up in Sarasota. So the options that the patients can be offered over in these two places is just phenomenal. I mean, many times, they don't get the same options up in many academic centers here in Florida or even outside of Florida. So it's very, I would say for us as professionals, it's an extremely gratifying position to be in because you have, the standard of care approaches, and plus, if you don't have any standard of care approaches, if you've exhausted them, you can always talk to the patients about phase 1 trials and so many phase 2 and 3 trials that we are a part of. The field has bloomed over a period of, a few months, such as, for example, lung cancer, where there were just only very limited options. Now, in the just past 2 years, there have been so many new approvals. Just a few days ago, there was another new approval by the FDA. So, I mean, there's just so many new things happening. In every meeting, there's some, breakthrough new treatment that, everybody's talking about. So it's so fascinating. It's so fast-paced right now. It's good for us, and also it's great for the patients because they have so many new options now. But yeah, I mean, who knows what will happen in the next 5 years? It's hard to predict, but the pace that the field has been moving on, it's just, we'll see so many new technologies, new, treatments, new drugs, immunotherapies, targeted treatments that'll emerge and that'll change, the landscape of treatment overall. You will see that the survival will keep getting better in patients. Even though, the incidence of cancer has sort of like plateaued in many instances, but the prevalence is going up because more people are living now. More people are surviving. So, and that's exciting.